Good morning.
Good morning.
Welcome to Plastic Surgery 90210. My name is Ariel.
And I'm Dr. Katzen.
And today we are so excited to announce that we have sponsors for our podcast.
Yeah, very cool.
So I'm so excited to announce that Fairgrounds in Beverly Hills, a coffee shop with amazing food, is now sponsoring our podcast.
Yay, very cool.
So that is why we have these beautiful drinks in front of us. I have an iced latte with cold foam. What do you have?
I have oat milk matcha. Sounds really cool.
Oh my gosh, look at that color. Cheers.
Yep. Cheers. Wish you could taste it.
Oh my gosh.
But you can go check them out.
That is so good.
They're about 2 blocks away from us. Maybe a long delay in our podcast.
Yeah.
So we can need to drink these.
How do you like it?
It's really good. How about yours?
I love mine. Mine is sweet. The cold foam is so nice and thick. And you haven't had an oat milk matcha latte in a long time.
Nope, a long time. So it's really good.
Back to what we're talking about today, men's plastic surgery. We're going to be talking about the rise of men's plastic surgery, the stereotypes, and why it's so popular these days. Fun fact, over the past 2 decades, male plastic surgery has increased 325%.
Wow, that's a lot.
Yeah. You got to think there are many different types of plastic surgery.
Yeah, and I wonder if they include Botox and fillers with that. They may, you don't know. But I think it probably has to do with more liposuction. Liposuction is the most common procedure, and if you look at a rise in a certain subsector, it's probably going to be a rise in liposuction. So I can see that definitely with the Vaser, high-def six-packs, liposuction pretty much anywhere, and it becoming more accepted, if you will.
Speaking of the most popular procedures for men, you are correct. Liposuction was number 1.
I was correct?
Yeah.
Wow.
Yeah, you must be like
First
an
time.
expert or something. It says specifically like the abdomen, flanks, waist, and then it leads us to male breast reduction.
Yeah.
Yeah, that's a common insecurity for men. Gynecomastia is another way to describe female breast, right?
Yeah. So gynecomastia, gyneco, female, mastia, breast. So basically they are female breast tissue on a male body. And typically it's underneath the nipple. Typically the cause is unknown, but it can be from a variety of things like alcohol, marijuana, other drugs, genetics. But usually the most common cause is an endocrine or a hormone imbalance. And usually it's a hard lump underneath the nipple. So it feels like a walnut or a grape, but it's usually a firm mass. Some other presentations can be just fatty tissue throughout the rest of the breast. That's typically not gynecomastia because it doesn't have the glandular component, but it can have, fleshy, soft breast throughout.
And quick question about gynecomastia. So if you have that kind of hard walnut under there, can that be taken out with liposuction?
Depends. If you use the Vaser, in my experience, a lot of them can, because the Vaser breaks up that scar tissue and melts it. So if you use the proper technique, if you use the proper settings on the Vaser, it can melt those. But if you can't melt those, all it requires is a small incision underneath the nipple areolar complex, and you take that mass out.
And because you're taking that mass out, it's not going to grow back, right?
No, it's not going to grow back. So you take out that lump, throw it in the trash, it's gone.
Like with liposuction, you're throwing those fat cells away.
Yeah, it's gone. It's not like a sponge where we're just sucking it out and then it regrows.
Okay, good. That's a pro of getting this surgery. Another really common procedure is blepharoplasties or eyelid procedures.
I could see that.
Yeah.
Yeah. Blepharoplasty, it's a very common procedure. There's the upper blepharoplasty and the lower blepharoplasty, and it can be done under local in the office. Outpatient procedure. Takes maybe about 15-20 minutes each eyelid, depending on what we need to do. On the upper eyelid, it can be excess skin, it can be excess fat, it can be weakened muscle. Just depends on the patient and what you need to do. On the lower eyelid, it can be usually excess skin or sometimes excess fat.
And a lot of times, can you talk about why people get this procedure? It's not just aesthetic. Right?
Yeah, so it's not just aesthetic. With the upper eyelid skin can be so much that it can hang over the upper eyelid. So typically at the end of the day, it's kind of hard to bring up your eyelids.
Yeah.
It can be difficult seeing the computer screen, and then it gets kind of even scary. You're on the highway driving home, and you got to raise your head back to bring your eyelids back to see street signs and street lights.
So just in general, it's just obstructing your view.
It's hooding of the eyelid. And basically what happens is the muscle, the frontalis muscle among them, is trying to keep the eyelids up all day long. And after about 8-10 hours at work, maybe you're staring at a computer screen, the muscle gets kind of weak and the eyelids fall down.
Oh no.
Okay. And then Botox actually makes it worse. I get so many patients coming in for blepharoplasties, and they're like, look, doc, I need a blepharoplasty. And I'm like, well, do you do Botox? Well, yeah, come to think of it, every 2 months I do Botox. Well, what does Botox do? It
freezes the muscle.
Paralyzes the muscle. So if you have a muscle here that's constantly trying to bring your eyebrows and your eyelids up, and you paralyze that muscle, what's going to happen to the eyelids? It weakens the eyelids. So I tell them, look, lay off the Botox for about, maybe about 6 to 8 months, see what happens. And a lot of the time, they don't need a blepharoplasty.
Wow.
So, we fixed it because the Botox was doing too much.
Wow, okay.
Sometimes they'll do Botox, sometimes they'll do Botox in the center of the forehead and not do Botox laterally, and that allows this muscle to still function, so that allows the lateral portion of the eyebrow to elevate and the lateral portion of the eyelid to elevate. So if you're having eyelid problems and you're still doing Botox, quit the Botox, see what happens.
Okay. The nice part about these procedures too, like the blepharoplasty, is a lot of times it's covered by insurance.
Depends on your insurance. Not all insurances cover it. You need to prove a couple of things. One, that you can't see, your visual fields are obstructed. So that little eye test where you sit in that egg? You sit in an egg, and they have those little white dots, and they ask you, can you see that? Can you see that? Can you see that? Yeah. So basically, if you can't see like the upper portions, you may qualify for this surgery because your visual field is obstructed because of the eyelid skin.
Got it. And autoplasty is another one that came up.
Yeah, what is autoplasty?
Ear reduction.
Ear plasty means to mold. That's how we got plastic surgery, not because of the word plastic, like this stuff, but plastic means to mold or bend. So that's how we got plastic surgery. We were molding and bending tissue to make it better. Okay. So an OTO, not like the car, auto. OTO is the Latin for ear. Okay, so when we're doing ear plasty or molding, we're working on the ear. We're doing a variety of things, but autoplasty, probably the most common autoplasty I would imagine is bringing the ears back. So what happens is, if you look at the ear, it looks like a bowl, and then it's got a rim around the edge. All right, and with the bowl, sometimes the bowl gets too steep, it gets too big. So if the bowl is too big, that means the ears project like that. So one way to do it is to make an incision behind the ear, and you actually pin the ear, or ear pinning it's called. You pin the ear back to the scalp so it doesn't flare out as much. Another way I prefer it, and I think it's more permanent, is you reduce the height or the rim of the bowl. Okay, so you take out actually a little bit of cartilage, and that allows the ear to collapse on itself.
You take out like a wedge of it? Okay.
We got a whole YouTube video on it. It's really cool. It works really well.
We also noticed that the stigma around male plastic surgery is fading, making it more socially acceptable. A lot of people thought plastic surgery, women, fillers, big breasts. What do you think about that?
So again, it really depends where you are and what you're doing. Okay, here we're in Beverly Hills. We're a distinct community, but we get a lot of international patients too. But it also depends on what your practice is specializing in. If you specialize in female breast augmentation, well, that's the majority of your practice. We do a lot of things in our practice, and I would say maybe about 40% of our practice are male patients, typically after significant weight loss. So we're doing things like tummy tucks and body lifts. We're doing thigh lifts and breast reductions and arm lifts and face lifts and things like that. We also have another subspecialty of mine is laser high definition liposuction, sculpting out those six packs, getting those ripped six packs, sculpting out the arms, getting really defined arms and biceps.
Have you seen a generational shift in how men view aesthetic enhancements?
I think it's more accepted now. We're getting younger and younger men come into the office for elective procedures, whether it's liposuction, gynecomastia, removal tummy tucks. I think it's becoming more accepted, and I think men are embracing the field a lot more than they used to.
Yeah, I think self-care is for everyone. So they've people are really stepping into that and accepting it. I also see more men getting like preventative Botox.
Yep.
We have a lot of men basically just willing to invest in themselves.
Yep.
Whereas before, I think they might have been a little insecure to do that. So this is a fun question. It's do you see motivations kind of shifting amongst like younger and older generations?
I think you're right. I think the younger generation is more willing to have many procedures, maybe more extreme procedures than the older generation. But then it may also be a age and health factor. Maybe the older you are, then you don't want like a bigger procedure. So say a younger person comes in, they may be more willing to have like the 360 body lift and the thighs, stage 2, the arms and the chest, versus maybe somebody in their 60s just coming in for, maybe I'll just settle for the tummy tuck.
Right. Yeah. That makes sense. We've also seen an increase in male BBLs at your practice.
Yeah. So male BBLs, we take out, well, very common procedure for males is, look, you know, doc, I'm at the gym all the time. I exercise all the time. I eat nothing but protein, but I can't get rid of these love handles. I probably hear that about 10 times a day. All right. And it's true. That's an isolated area of pockets of fat just above the hip bone, superior crest, love handle region. That's very, very difficult in men to get rid of. So we do a little liposuction, and we'd be taking that fat and like throwing it away. So instead of just throwing it away, we can recycle it. We can reuse it. So I ask my patients, look, you know, we're throwing the fat away. Instead of just throwing away, you want to recycle it. Do you want anything bigger? And there are a variety of things that we can make bigger. Among them, the buttocks, okay? We also inject the hand. We can also inject the face with fat. Yeah, so there are a lot of other options.
Yeah, and big butts are trending for men. I mean, Kike Hernandez from the Dodgers, he has a big butt, and that's what everyone's Instagram feeds are full of.
Not mine.
Oh. Men often prefer procedures with quick recovery time and minimal visible scars. What procedures do you think those would be?
Again, the less invasive you are, the quicker the recovery and less downtime, but then maybe the less bang, the less improvement you see. So we could do a procedure like Botox and you may see a subtle change. Or we could do a procedure like a body lift and a thigh lift. Okay, those are radically different procedures, but you know, usually the bigger procedures, more downtime, but more of a result.
Yeah, I would say maybe like Vaser or traditional liposuction. You will have a lot of bruising and swelling, but minimal scars at the end.
Minimal scars.
What kind of procedures do you want to see more from your male patients?
Yeah, so I love liposuction. I love Vaser liposuction. I think it's a very powerful tool. I love doing the Vaser high-def six-packs, getting a sculpted abdomen, and I also love giving biceps and triceps to males. I don't think the males realize how easy it can be done. The recovery is not that bad, and we can really sculpt out the deltoids, the triangular muscle here on the shoulders, and the biceps and the triceps. Give me maybe about 2 hours, about an hour on each arm, and we can make life-changing results on your arms. We have patients, you know, that have the procedure, never been to the gym for their upper body in their whole lives, and after the procedure, they may not need to go to the gym anymore because their arms look so ripped.
Yeah,
it's a really good procedure.
Oh man.
We can do it to you.
Yeah, do it to me. It's so unfair. I feel like I've been working out so much and you can't see it at all.
Yeah, and that's one of the problems with working out. Now, I fully endorse working out every single day, you know, cardiac, you know, anaerobic and as well as muscle training. That's very important. You got to do that every day. But to maintain developed biceps and triceps, you have to work out your arms every single day or every other day, okay, to keep that tonality. With liposuction, give me about 2 hours and you may not have to work out your arms anymore because we get them so sculpted.
Also, I feel like no matter how big my muscles get, I can't see them because of the layer of fat above it.
Yeah, so, you know, with the Vaser liposuction, we remove the fat.
Yeah.
And we remove the fat around the muscles so you can see the muscles underneath.
Would you say this is kind of a stubborn fat area?
Yeah, it's very resistant to exercise and dieting, but just keep at it. Keep going.
Nah, let's just do the Vaser.
All right, let's do
2
Vaser.
hours.
All right.
And the neck. Okay, let's see. How do men usually find their plastic surgeons? What advice do you have for them when looking for one?
Yeah, so I think it's very important to do your research, okay? Choose your platform, but choose your platform carefully, okay? So the platform I think is probably the best is Google. Google's a international search engine, is probably the biggest search engine. Second biggest search engine is?
YouTube?
YouTube, very good, very good. So that's another very good selection. So basically dial in what you want, what you're looking for, okay? And then look at plastic surgeon's experience. So I think you can judge experience best on number of before and after pictures. That proves to you that that procedure has been done many, many times with a plastic surgeon. So if they don't have any pictures, beware. You know, maybe go elsewhere.
Yeah.
If they have a few pictures, well, keep on looking. What I would do is I would look for the plastic surgeon who has the most pictures, shows their experience with exceptional results, and go with that plastic surgeon, even if you have to travel out of state or out of country. We had a patient this Saturday who came internationally from Africa for her procedure. Okay, so we have patients from all over the world. So if you can't find somebody local, travel. It's worth that experience.
Do you prefer when patients, like male patients, describe if they want more feminine, masculine results? For example, Nikocado Avocado was like, I don't want to look masculine. He's like, I don't mind being a little curvy, and we gave him that curve.
So that's the cookie cutter debate. Okay. So with the cookie cutter debate is you'll go to some plastic surgeons' websites and all their facelifts look the same. All their breast lifts look the same. All their breast augmentations look the same. All their tummy tucks look the same. It's because they do the same technique and the same outlines and the same dynamics to the patient. What I prefer doing is we deliver what the patient wants. That's the most important thing. It's not what I prefer to do, it's what the patient wants. So with body lifts, tummy tucks, pretty much all these procedures, we tailor it to what the patient wants. So it's very important during the pre-op assessment when I ask the patient, what are they looking for? And they tell me, oh, I want it higher here, I want it lower there. And then I show them often pictures. These are what we can get you. This kind of look, this kind of look, this kind of look. And even on my website, you should be able to find patients that look like you. That's why one of the reasons why we have so many pictures too, is so you can find a patient that looks like you and you can see their post-op results to go, oh, I like this, or I don't like this, and I don't like this because of maybe the incision's too low or too high. So a perfect example on Nick. He lost how much weight?
250.
He lost 250 pounds.
Yeah.
Amazing. Okay. And with that weight loss, he wanted more of a feminine figure as opposed to more of a masculine figure. So that's what we delivered with his body lift.
So you do like it when they kind of explain to you?
Absolutely. Absolutely. The more you can convey to your plastic surgeon, the more we can sort of deliver on our end.
Yes. So that was our podcast on male plastic surgery procedures.
Yep.
Any more questions about these procedures, please comment below, give us a call, DM us. There's tons of ways to contact us. What's our phone number?
310-859-7770.
Yes, and don't forget to check out Fairgrounds. It's in Beverly Hills. We're just one block away. Next week, their specials are going to be a banana bread latte, a BBL. Yeah.
BBL, very
So
cool.
go in and ask for your
out.
BBL. Yeah. Tell them Dr. Katzen sent you. And also, they're going to have an Earl Grey matcha, which hopefully we can try.
That sounds really good.
Yes.
So get a BBL there and get a BBL here.
Yeah, get a BBL at both places. All right, thank you so much.